Have you been on a 14-day quarantine or lockdown because of COVID-19? Hi, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health. And today we're going to talk about the health effects that those lockdowns and those quarantines can have throughout the body, emotionally, physically. And we obviously know that I think it's reasonable to assume that these quarantines reduce the number of COVID cases, the COVID-19 spread. So we're reducing infections and deaths by, trying to be responsible in quarantine and do what we would call lockdown, right? But we also know that this is creating psychological issues, physical problems with people's health. And so when people are put in a short period of time where their activity is reduced, it's going to decrease their metabolic activity. It's going to, over even a period of 14 days, we see it increase abdominal fat. We're seeing it, muscles start to atrophy. There's a higher amount of insulin in the system, so the sensitivity to insulin starts to reduce. We're seeing just changes in glucose and insulin metabolism. And really, it's impairing the muscle building process. So people lose muscle mass, muscle synthesis starts to slow down. And then you see it impact the inflammatory process, and inflammation starts to go up when people are sedentary. So this is impacting organs throughout the body. The systems throughout the body are being impacted by this inactivity. Now, that's the physical aspect, but we're also seeing it affect people emotionally.
Absolutely. Depression, fear, anxiety, they're at an all-time high. And those aren't the only things that we're noticing. You notice higher amounts of irritability, mood swings, insomnia. People can't sleep. They're constantly churning and worrying. Even it's become to the point that they're starting to consider it post-traumatic stress.
Yeah.
So
it keeps evolving, and obviously this process, when it first started, we didn't know it was going to be going on, a year later. We thought, well, we'll do this and move through it. And unfortunately, people's lives have changed, and the way that we do business and our daily activities has probably changed forever. So let's talk about how we address this. How do we actually turn this around? And let's really talk about the benefits of physical activity. It can increase your glucose uptake. So you're going to pull that out of the bloodstream, burn it as fuel. You're going to increase your metabolism when you do that. You're really going to be able to maintain muscle mass the more active you are. So just because you're told to quarantine for 14 days doesn't mean that you should be sitting there, binge watching Netflix and HBO Max or whatever else that you've plugged into. Let's stay active during these lockdowns. That's going to have a benefit on your triglyceride levels, your lipid levels. It lowers blood pressure when you're more physical, right? So we want to stay active during these quarantine times when you're staying home. Don't just get sedentary. Let's get active. What else?
Well, as soon as we do get active, that will boost us emotionally. Physical activity gives us a feeling of vitality. Just working out lets you feel stronger and better, and that's good for your mind. Over that, that'll improve your mood, and it's proven to show increase in cognitive function. So instead of binge watching or zoning out on your phone, you can go get some blood flow to that brain, go exercise a little bit, and feel good about it.
You bet. So let's talk about how you do this. If you can't go to the gym, you can't, go work out at a facility, what are some things that people can do to engage in physical activity?
So people have tried this for a few months now. You can get the steps you need and the heart rate up just in a small confined space. You can walk in space, you can squat in a short area, you can do push-ups, sit-ups, any of those things. If you have stairs in your apartment building or house, you can use the stairs as exercise. Taking short, brisk walks outside, you don't have to go on a mile-long walk. 3 walks a day at 10 minutes apiece is shown to help get all these benefits.
Yeah, you can get all these benefits just by doing a short 10-minute walk, like you were saying. I think it's, people think, well, I got to do an hour of exercise. You don't have to start there. Start small. If you haven't been exercising, don't overdo it. I think that's one of the biggest things we see is they engage in exercise and they overdo it and then they get injured. So start small, work into this, and realize it's going to break up that space so you have these benefits that we're talking about. And you don't need equipment. You don't need to feel like you have to go to the gym. While you're quarantining, obviously we don't want you going to the gym. So these things are great ideas. The other thing is, get outside where there's some green space, where you can socially distance from people. You can still isolate yourself and go for a walk in those spaces, avoiding people, and yet you can enjoy some of the outdoors, okay? So, just realize there's a couple things that I would say, make sure that you're talking to your physician about physical exercise that's right for you. And during an acute infection, we really don't want you to really over-exercise. Exercise, it has to be matched to your physical state. But I hope this helps and gives you some ideas on things to do other than watching Netflix during your quarantine. And check out some of our other videos down below.